Member from Coquitlam-Millardville.
Thank you, Madam Speaker. A senior's budget, and you don't even mention the word senior? I heard a completely different budget. Honourable Speaker, in the Fraser Health Region, only 13 of 79 facilities are meeting the minimum staffing benchmark for seniors' care. That's just 16%. That's actually, Honourable Speaker, the best record of all 5 health authorities in this province. A mere 16% meeting the minimum standard of care hours. In the Interior Health Authority, only 5 of 75 facilities meet the minimum standard of care. On the island, it's only 2 of 59. 2. I want to ask the Minister when seniors in this province can expect adequate residential care in this province.
Minister of Health.
Thank you, Honourable Speaker. And again, we are spending record levels on health care, and a large portion of that, of course, is directed to our seniors. But on top of the acute care that we provide, Honourable Speaker, the home and community supports that we provide, the residential care supports we provide, all of those are increasing, Honourable Speaker. This budget sees the largest increase ever in terms of dollars in our healthcare budget, much of it directed towards seniors. We are happy to come to an agreement with Ottawa for home and community care that will see directed, targeted funding for seniors' care, and the members opposite will see that plan as it is developed over the next few weeks now that this agreement has been signed. And Honourable Speaker, there'll be lots of good news in it for seniors' care in the province of British Columbia.
Coquitlam-Millardville.
Thank you, Honourable Speaker. BC Liberals have been in power for 16 years, and the benchmark for hours of care per resident per day is 3.36 hours of care. And 91% of facilities aren't meeting those necessary care hours. I think that's disgraceful, Madam Speaker. So what does this mean when 91% of the facilities that this government is responsible for funding don't get sufficient funds to make sure that there's sufficient staff? Well, it means that seniors can't get a proper bath. It means that they have to sit in a chair for longer than they want. It could mean that they sit for hours because there's no one to assist them to move to another part of the facility. It also might mean, Madam Speaker, that they sit in soiled clothing for longer than they care to. These are all indignities to the seniors of our province, Madam Speaker. So again, I want to know from this government when seniors will finally get the care they deserve from these BC Liberals.
Minister of Health.
Thank you, Honourable Speaker. Honourable Speaker, I will happily compare the record over the last 16 years on every file in healthcare versus the 1990s when, Honourable Speaker, you could not find a placement in residential care. We have added 6,500 publicly subsidized residential care, assisted living, and group home beds since 2001. Health authorities invested $2.9 billion on home and community care in 2015-16. That's an 88% increase since 2001. Other benefits for seniors, we mentioned the MSP reductions that over 90% of seniors will benefit from, Honourable Speaker. I'm told that around the province, over 100,000 more hours of handy-dart service, Honourable Speaker, and a historic agreement with the federal government that will see targeted funds directed at home and community care. Honourable Speaker, we will continue to make sure that our valued seniors are looked after in the province of British Columbia.